But I showed you the Koji, do the leg grab, do the inside trip, right there.
My martial arts career started at 14 back in 1972. I started in Taekwondo, stayed with that for a couple of years, and then I found Judo. And I like Judo. We do a lot of high impact throws, a lot of grappling, and a lot of submissions. And that means leg locks, arm locks, and chokeholds. I developed a blood clot in my femoral vein, and it started to cause a bit of problem. I noticed a lot of swelling and a lot of bruising in my leg, and it started to be a point where it started to be a detriment to my sport, where I couldn't function as well. There would be times I'd just come in and coach and I wouldn't practice at all. I have a friend, his name is Dr. Sadler, and I actually used to coach him several years ago. And one day, just out of the blue, he walks in here. And I look, and I do a double take, and I look, and I said, oh, that's Rick. So I walk over there, and we start talking, how are things? And I go, hey, as long as you're here, can you take a look at this? And I showed him my leg.
After the practice, Greg asked me to take a look at his leg because he thought he had a problem. And in fact, he had a real problem.
I had what people call a cankle. You couldn't distinguish my calf all the way down to my foot from my ankle. It was just one solid column.
He was complaining of pain in the lower leg. And when I looked at what we saw was a red, brown, sort of a band, and that's classic for people who have advanced venous insufficiency.
He explained what the situation was, and he says, look, that's not only ugly, that could end your career.
Then he told me that he'd recently had a deep vein blood clot, and that's because he had a clotting disorder. And so when I put those two together, I realized that most likely he had severe venous insufficiency. So I had him come by the office, and we did an ultrasound, and we made the diagnosis. The veins of the legs are designed to carry blood back up to the heart. When the veins break down, either through trauma or aging or hormones or a number of reasons, the blood now runs backwards. And when that blood runs downhill, it's just like a big water tower with a reservoir and a standpipe. So now the pressure becomes very high in the veins and the fluid leaks out. And when that occurs, you have a whole inflammatory process, which is very painful and leads to skin breakdown.
It's not a question of vanity, it's a question of being able to function.
About 10 years ago, there had been a revolution in technology where now we can close off the vein, we can stop this pressure and not strip it. And we do this using a catheter. Some people use a laser. Probably the more popular technique, the one we use at our clinic, is called radiofrequency ablation. Basically, it's a microwave, and we heat up the vein, we cause it to close down. This technique has been so widely accepted by patients who have had it done. They're very pleased. It's an easy procedure. You do it under local. You drive yourself into the office, drive yourself home. There's no need for sedation, no need for general anesthesia. So it's equally effective with minimal cost and minimal hassle of getting it done. The recovery is remarkable. Typically for vein stripping, a person is off of work for 2 weeks. When we do it here in the office, you're off of work for about 2 hours. You come in, get it done, you can go back the next day or go back that afternoon. So it's very, very easy to tolerate and get into your life.
I didn't realize it was that big of a problem. I eventually just thought, oh, it'll go away.
40% of vein disease in the United States is actually in men. But men rarely come in because it is not a life-threatening problem, and most men in the United States really don't like seeking medical care. And being one, I understand, I don't blame them. Nobody wants to go see a doctor. Unfortunately, a lot of my patients who are men who come in are advanced, like Greg. He was at grade 4, sometimes grade 5 and grade 6. We can make them better, but you can't always bring them back to normal. Greg is one of the exceptions in that we were able to catch him relatively early, and he had remarkable results.
After the procedure, I was told it could take up to 2 weeks before I saw a reduction in the swelling. I saw a significant reduction in 3 days, and I couldn't have been happier.
It's okay to admit you have a problem. Nobody would think of going to work without their hard hat or their protective gloves. Why would you tolerate that kind of problem with your legs and allow your legs to become a disability when there's no reason for that?
Before I My ankle was so swollen, my leg was so swollen, my functionality was extraordinarily limited. I couldn't do my practice. After the procedure, it was amazing. The results are incredible. The swelling is all but gone, and I have no limitations whatsoever on the mat.
Talk to your wife, talk to your friends, come in, let's look at it. If there's nothing wrong, then you don't have to have anything done. But at least you're not going to put yourself at risk for a lifetime of disability for no reason.